There we go. I pledge allegiance to the
The
flag
flag
of the
of the
United
of the
States
United
of
United
States of
States of
America,
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 States of America,
to the republic
and
for which it
republic for which it
stands,
republic which
stands,
it
one
stands,
one
nation,
nation,
one
under God,
nation,
under God,
under God,
indivisible,
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 with liberty
with
and
with
liberty
liberty
justice
and
and
for all.
justice
liberty
for
and
justice for
all.
justice
all.
for all.
Thank you.
Good morning. Thank you for, and the one thing that I ask is that I believe everybody is muted. So please refrain from asking questions until we're done with the presentations. There will be a portion at, after presentation for question and answer, or like I don't know who's like me. Sometimes it comes to my mind and then it just left. So you can also go ahead and type it in the chat box and we'll go from there.
If I could remind everyone to mute their cell phone and please put the barking dogs on the back porch. I'd like to welcome everyone who's on the Zoom meeting right now from wherever you are in the state of Washington. And I'd like to go straight into our presentations. These individuals who are on the agenda today were selected to provide us with information that we hope will give you the information as well as how to access services for yourself, the veteran that you're caring for, or other veterans in our community. Okay. Dr. Morantis, my name is Chuck Wharton. I'm the moderator of sorts for today's program, and I've already introduced you and as the VA Puget Sound Deputy Chief of Staff to be giving some information on the community care program. So if you'd like to start with that, if you're prepared, we could do that right now because we got about, I don't know how many people online anxiously waiting for this information.
Okay. And how much time do I have?
Well, we
You
were
can
hoping.
have as many, like we're hoping that it's for an hour and a half. So whatever is the pertinent data, because I know there will be some question, ma'am.
Okay.
Thank you.
All righty. Good morning, and I'm sorry about the technical difficulties that we had, but as Tammy mentioned it, third time's the charm. So I'm Connie Morantis. I'm the Deputy Chief of Staff at VA Puget Sound. And joining me today as a presenter is Lindsay Pineda, who will be covering our caregiver program support program, and she's a supervisor of that program. So to all of you on the Veterans Affairs Council Committee, I'd like to thank you for allowing us to come and speak with you and to provide you the opportunity to connect with us today. I thought it'd be actually helpful to give you a little bit of background in regards to VA Puget Sound. So we provide comprehensive care to more than 145,000 enrolled veterans across the Pacific Northwest. Of those, 108,000 are actively receiving care at one of our sites of care. As the VA's fifth largest research program, we perform research in virtually every major clinical department, including traumatic brain injury and multiple blast exposures, memory improvement and Alzheimer's disease, PTSD and deployment health, Parkinson's disease, diabetes, cancer, substance abuse, lower limb prosthetics, genomics, and health services. So we offer a breadth of services. Additionally, we have 7 nationally recognized centers of excellence in areas from limb loss prevention and prosthetics engineering to primary care education and substance abuse treatment. And for a quick update, I also wanted to let you know about our expanding primary care expansion efforts to make it easier for our veterans to get care closer to home. We recently held our new Puyallup Clinic grand opening event with Congressman Kim Schreier on July 9th. And we started caring for vets at that site on July 15th. The opening of the Puyallup Clinic comes on the heels of our Edmonds Clinic, which came online June 14th. And we plan to open our new clinic in Olympia before the end of next month. Across our new clinics, we'll be caring for approximately 11,000 enrolled veterans. For primary care across all of our sites of care, we provide primary care for 85,000 of our enrolled veterans. Additionally, we will be opening up a new 4.6 million, 26,000 square foot CBOC in Everett in mid-2022. We are also exploring new clinics in the Auburn, Kent area and the North King County areas. So 2 more large clinics that we plan to open up within the next couple of years. Together, the new clinical footprint will allow VA Puget Sound to directly serve Everett and Olympia, 2 of the major metropolitan areas in Western Washington with no VA facilities currently. And our new care sites will create new capacity for our areas of highest growth in South King and Pierce County, as well as provide better outreach to rural veterans in King County. We are also actively planning for future clinics in Auburn and Woodinville. These changes are all about better serving our veterans at locations that are more convenient to them. So that's just background of who we are and where we are. Now we're going to get into community care, which is one of the 2 topics that you're most interested in, is my understanding. So community care, several factors are contributing to our current consult backlog. As you're aware, the Mission Act expanded the eligibility for veterans to receive care in the community. Given the rurality of Visit 20, just think also in terms of Alaska, but also Western Washington, all of our islands, the Olympic Peninsula, the Pacific Coast. We are also a very high growth area. This is one of the few visits that's actually growing in size. This led to a significant increase in the volume of requests for community referrals. Add to that the implementation of the new community care network. So previously there was the Choice Act. Now we have the Mission Act, and under the Mission Act, it included the development of a new community care network, which took place in August 2020. That actually led to additional challenges because the vendors who were previously enrolled under the Choice program declined to enroll in the new CCN, which also contributed to gaps in the network in the more rural areas. So there are areas where we just can't find the type of providers that we need to provide care for our vets more locally. An additional contributing factor to the referral backlog was the national shortage of medical support assistants, which I'll be referring to as MSAs. These are the folks that actually do the scheduling. We currently have a 20% vacancy rate, which actually is down from 30% at its peak. The biggest contributing factor, though, to our consult backlog was the COVID pandemic. During the COVID-19 pandemic, routine care across the nation was placed on hold while medical facilities focused on treating the increasing number of patients with COVID and supporting mass vaccination programs. As routine care was deferred, we were limited to treating only the very sickest patients and those in need of urgent care. Deferring routine care, in addition to transitioning to the new community care network, created a large backlog of requests of care. As we started opening back up for routine care, we noted a significant increase in the number of community care referrals that we received. Prior to COVID, we were receiving about 8,000 community care referrals a month. Since COVID, it's gone up to about 10,000. Currently, the total backlog of unscheduled consults is greater than 29,000. We are very much aware of the delays that veterans are experiencing in getting care and how frustrating this can be. Our greatest challenge has been in responding to the large volume of backlog referrals for care in the community. I want to assure you all that our community care teams are working tirelessly to prioritize the urgent consults and reduce the time to scheduling appointments. To make sure that our veterans receive the care that they need when they need it and in the proper modality, we are renewing our focus on the referral care coordination. So what is referral care coordination? Well, through this process, veterans are given the options for care delivery. So you can have a face-to-face visit, you can have a telephone call, you can have a video call, and they're advised that in most cases we can actually provide care within these virtual modalities much sooner or faster than we can in a face-to-face care. Veterans who opt in for community care will be asked to provide the name of their preferred provider. So up front, when they request to see someone in the community, if they have someone in mind and that provider is in the network, that significantly speeds up the process for us being able to schedule that first appointment. If the veteran does not have a preferred provider, we have access to the list of in-network providers, and we can provide them the name of 3 providers within their area that they can reach out to and determine who they want to see. Having this information in advance greatly expedites the scheduling process. And a lot of this can be done before the consult even gets to community care. In addition to the referral coordination, we're also piloting veteran self-scheduling. So this takes what I was just referring to and takes it one step forward. So if the veteran knows who they want to see and that care has already been approved, they can actually contact that vendor or that provider and schedule that a first appointment. So they don't have to wait for someone from our community care department or TriWest to contact them to coordinate that appointment. They can actually schedule the appointment themselves. This program will actually help immensely with what we refer to as the basic care. It's not the complex care. And so you can imagine that for a dentist or hearing aid test, optometry, physical therapy, and chiropractic care, this will actually make it much simpler for the veteran to get approved for that care, and just assuming that the provider is in the network, just go and schedule the appointment. So to work on this backlog of consults, we're in the midst of a facility-wide stand down. So right now it's all hands on deck. All of our providers, nurses, and MSAs are in the process of reviewing every single one of those consults that's backlogged to see, one, is the care still required? And then if the care is still required, to make sure that it's prioritized appropriately. We want those that are the most urgent or the ones that need to be done timely to be scheduled first over the more routine consults. We're also looking at our workflow to ensure that we're optimizing our efficiency moving forward. We've already developed areas where we know that we are probably redundant or having to touch consults more often than we really need to. We're continuing to work with TriWest with some of the network and billing issues. We've engaged with our VISN office and the National Office of Community Care to help resolve some of these issues. We're also utilizing the option in the TriWest contract that allows us to send them referrals that require basic care coordination for scheduling. Since January of this year, we've sent about 25,000 of these basic care referrals to TriWest for their assistance in scheduling these referrals. We're also aware of the long wait times on the community care phone lines and agree that this is unacceptable. We recently modified our phone system to expand the capacity and to accommodate the increased number of calls. We have dedicated staff answering the patient inquiries, as well as a separate line for community providers who have questions about referrals. The high volume of calls is a symptom of the backlog of consults. As the consults are worked down, the call volume should also decrease and the wait times will become shorter for our veterans and our vendors. An additional area of focus is minimizing duplication of work and better coordination with the ordering providers to ensure the missing elements are provided up front. The more accurate information we have at the very beginning, the much more quickly we can actually process the consult, and it avoids multiple calls to the ordering provider to get that additional information. We're hiring a community care liaison who will be able to work with the vendors to improve communication and help them navigate the CCN process. We're addressing our staffing vacancies by utilizing every option available to fill these vacancies, including approval of a special salary rate, recruitment bonuses, offering telework, and pursuing remote hires. VISN 20 is establishing a centralized pool of MSAs to support the sites most in need of scheduling support. In the interim, VISN 20 has temporarily redirected 30 MSAs from other facilities to assist Puget Sound with our backlog reduction. This is kind of general comments to give you an idea of the background information and all the efforts that we've made to work down our backlog and improve how we deliver care to our veterans. The providing high quality and timely care is our #1 priority, and I can assure you that we are doing everything possible to improve our community care program. We have the 1-800 numbers if you all want them or need them for the customer service line for our veterans, and I can share that with you on the chat board. So I'm not sure if you wanted to have Lindsay present her presentation first and then do questions, or do questions and then have Lindsay do her presentation.
Let's have Lindsay do her presentation. I'm also saving all the comments on the side as well too, and I'll make sure any questions that don't get answered, we get emails for those folks so we can comment back after the meeting. But I say let's do Lindsay's presentation and then we'll jump into all the questions that are here. And I have them all in order. So I'll make sure everyone that's putting them in the comments in the chat box, I will be asking your questions in order. So thank you for sharing those.
Okay. All righty, Lindsay, it's up to you now.
All right. Can you hear me okay?
Loud and clear.
All right. I am actually in the meeting twice. There we go. Now I'm in it once. All right. Thank you so much for inviting me here today. And so I am pleased to talk with you this morning, almost afternoon, about the Caregiver Support Program. We recognize the important role of family caregivers, excuse me, sorry about that, in supporting the health and wellness of our veterans. It's vital. And VA Caregiver Support Program's mission is to promote the health and well-being of caregivers who care for our nation's veterans through education, resources, supportive services, and service excellence. Many don't know that the Caregiver Support Program is actually comprised of two unique programs to serve and support veterans and caregivers across all eras. The Program of General Caregiver Support Services, also known as the General Program or PGCSS, and the Program of Comprehensive Assistance for Family Caregivers, also known as PCAF or PCAFC. So first, briefly, the general program supports caregivers of enrolled veterans of all eras who are in need of assistance with one or more activities of daily living or need supervision or protection based on symptoms of residuals of neurological care or other impairment or injury. Services for those caregivers include resources and referrals, education, training, and support, and counseling in specifically related to the care of their veteran and the services that might help support the caregiver around that. So those that are wishing to participate in the general program can contact the Caregiver Support Program directly. And the phone number for our program is 206-277-6696, or we do have a program email. And our program email is PUG caregiver support at va.gov. So to talk about PCAFC or PCAF, prior to October of 2020, it was only available to veterans injured on or after September 11th. So eligibility expansion is occurring in two phases. Phase one occurred October 1st, 2020, when veterans, and so now it includes veterans injured on or before May 7th, 1975. Phase two will occur October 1st of 2022, when veterans of all eras will be eligible to apply. Eligible veterans must have a service-connected disability rating of 70% or more and must be in need of personal care services. We have excellent fact sheets available on caregiver.va.gov that explain exactly what personal care in need of personal care services is, as well as what is the application processing look like. So there's an application process fact sheet and an eligibility criteria fact sheet. In addition to the general program services, PCAFC participants have enhanced benefits, which include a monthly stipend, access to healthcare benefits through the Civilian Health and Medicaid program of the Department of Veterans Affairs, which is also known as CHAMP VA, mental health counseling, at least 30 days per year of respite care for veteran, certain beneficiary travel benefits, and ongoing monitoring. The application process has 10 steps, and each time the veteran wants to add a new family caregiver, the veteran and the new caregiver are required to submit a new application. There can only be one primary family caregiver who receives the monthly stipend, and there can be up to 2 secondary family caregivers at any given time. Applications may be submitted online at www.caregiver.va.gov. For those that wish to submit a paper application, they can be submitted to our secure fax at 253-589-4054. They may also be mailed in, and the application or the address to mail them in is on the application. Or if someone would like to submit them in person, you would want to contact the program at the phone number that I provided earlier, which is 206-277-6696, so we could talk with you about when to reach us or where to find us on campus. So that's a brief overview of our program and the 2 programs that operate under the overarching caregiver support program. And just a neat little number, since expansion occurred October 1st, we've received, this number is as of yesterday, 1,285 applications. And just to compare that, previously, we would receive about 225 a year. So it's been a really busy 10 months or so. I will, absolutely.
We're having some issues here. Let me unmute you, Tammy, just a moment. So Tammy has a little bit to add to that. You should be able to unmute now, Tammy.
Yeah, all I was saying is, hi, I'm Tammy Bagassi. I'm the Public Affairs Officer. I'm happy to do a summary of the remarks that Dr. Morantes as well as Ms. Panetta provided today, if that would be helpful. I can do that after this meeting.
Yeah, we thank you for that, Tammy. And are we ready for the questions portion yet? We can start going through the chat box questions. Let me unmute Connie as well.
Okay, so I'm actually starting at the top here and coming down.
So I can kind of help Connie. First, you had what clinics are available for Olympic Peninsula veterans?
So for the Olympic Peninsula, we have 2 clinics that are available. The first one is the North Olympic Peninsula, and that's actually in Port Angeles. And the second one is our Silverdale clinic, which opened up within the last 2 years. It's a beautiful new clinic in Silverdale. So both of those are available for the Olympic Peninsula. And actually, the Olympia clinic that will be opening up probably mid to late next month will actually be able to support the southern part of the Olympic Peninsula as well. So folks from Shelton will probably find it more convenient to go down to the Olympia clinic.
Awesome. Our next question comes from Sarah. In the Spokane area, I'm aware there are contracts that have been in the works for over a year with local facilities. Now I'm being told all contracts have been halted. Why is this, and what are they doing in the meantime to ensure veterans in need are getting the care they need? There are numerous local veterans currently in limbo due to the situation. And understanding the time here is limited, so I'd like to be contacted for further information. So Sarah, if you can send me directly your email, we'll be glad to respond to that. And I don't know, Connie, if you have kind of a shorter answer for that one right now, if you just want to connect with Sarah afterwards.
Yeah, so I think what we'll do is we'll have our Spokane counterparts connect with Sarah. I don't have any specific information regarding the contracts for the Spokane facility. All I can say is that I know that Spokane is going through the Cerner transition. They're the pilot site for the entire VA, and that may have affected some of their ability to maintain some of these contracts. I don't know. Sarah, we will have someone from our Spokane VA reach out to you and answer your questions.
And thank you, Sarah. I did receive your email. I'll make sure I pass that on. Our next question comes from Paul. On the CBOT clinics, are the CBOT clinics a relief valve for the VA facilities, or are they something that will replace care at the current VAs? And are the employees at the CBOT VA employee or contract employees?
Okay. So the CBOCs are actually an extension of the two main facilities. We have the two main facility, and I'm referring to VA Puget Sound. So we have the Seattle campus, the American Lake campus, and then we have our CBOCs, which are spread out across our territory. The CBOC clinics bring the basic care, primary care, and mental health closer to home. We also provide some specialty services as well, and also can make them a telemedicine hub. So the veteran can come to the clinic and connect with the specialty providers that are at the main facilities. The majority of our CBOCs are VA employees. I think you're aware that we recently transitioned from the Valor clinics, which were contract clinics, to VA-based clinics, and we're in the process of building the permanent replacement sites for these 3 clinics.
Awesome, thank you. Our next question comes in from Heidi. What about the Chehalis CBOCs? Lewis County, and I think you kind of touched on this a little bit, the Lewis County veterans are being told it's being closed in October and will have to transfer care to the Olympia Clinic. Lewis County has the second highest veteran population in the state. 85% of our veteran population are seniors, which brings several barriers such as transportation. Our unhoused veterans are now going to have to find a way to travel another 30 minutes to receive care. Lewis County may be smaller population-wise, but it is rather large geographically. The Lewis County Veterans Relief Fund has a contract to be able to provide transportation for appointments, but that is going to be full very quickly. Is the Olympia Clinic going to be able to provide proper and timely care for Thurston and Lewis County?
Okay, so I don't have the specific on the details of what's going to be happening with the Chehalis Clinic. I do know that there were issues with the, so just to let you know, the South Sound or Chehalis Clinic is also a contract clinic. It's run by our Sterling. These are contract employees, they're not VA employees. I don't have the specifics as to the final decision about the Chehalis Clinic, but I can comment that for a good portion of the veterans who get their care at Chehalis actually live north of Chehalis, and so that's separate from the Lewis County ones. But for those who live north of Chehalis, they will be able to get their care at the Olympia CBOC, and we are actually planning on expanding it to be able to accommodate the anticipated growth for that clinic as well. I'll have to get back to, I'm sorry, who is the, I have to scroll back up to Heidi Palmer to give her specific answers regarding the Chehalis Clinic.
Yeah, Heidi, and if you could support or provide your email, Heidi, we'll be glad to make sure we pass that along so we can get you a little bit more information. Our next question comes from John and Polly. I live in Clark County, Washington, and fall under VA Portland, and would like to know how far south you cover versus how far north into Washington does Portland, and if there is a part of our state between Clark County and your area that is not being reached for service.
So yeah, so I am aware that there's gaps that is more on the southwest portion of our state that aren't quite covered by either Portland or Puget Sound. And this is where our MMU, our mobile medical unit, was going out to provide care for those veterans. During the era of COVID, we had to pull back the MMU and it was brought back to the facility. We are trying to brainstorm on how best to utilize the MMU moving forward. In regards to how far south we go, so the furthest south clinic that we had was the South Sound Clinic, and that was in Chehalis. Anything further south of Chehalis was on the borderline between Portland, where those veterans were assigned to the Vancouver VA, versus the South Sound VA. We are fully aware that there's going to be a gap if the South Sound Clinic is closed and the veterans are moved to Olympia, and so we're working on what options we have for those veterans as well.
Thank you for that. Next question comes from Tammy, and it says the Phones for community care hang up on you after 1 hour on hold. I spent 3 hours on hold this week alone.
Yes, yes, I am fully aware of the issues that we've had with our community care phone lines. And this actually ties into two kind of contributing factors. So one, of course, is when you have veterans who haven't heard anything about their consult, they want to call in. The provider wants to call in, wanting to know what's going on with the authorization. And so this has tripled the number of calls that are coming into the system. We are focusing on getting the backlog down as fast as we can, because this is the long wait times are a symptom of the backlog. In the meantime, we're putting additional MSAs, medical support assistants, on the phones because of the challenges that we've had hiring MSAs. This is where the VISN providing support is coming in. So the VISN is sending us 30 MSAs to be able to support the phone lines and to work down the backlog so that over the period of the next 2 to 3 months, you'll see a significant improvement in timeliness and decrease in wait times, both for getting the referrals as well as the phone lines. We are aware of the phone line issue. We're doing everything that we can. And as soon as we get the bodies from VISN 20, who are actually in training right now, and they'll be able to start working next week, you should see significant improvement in those areas. Again, I fully apologize.
All right, looks like next question is from Tammy Wells. There's also a disconnect between VA PCM clinics and CC. What community care wants on consults and what the clinics are providing are different. If the referrals are not complete or are missing ICD-10 codes, community care staff are not reaching out to the clinics for clarification. They just say, oh, well, and the process is as is. Then the patient is expected to coordinate getting the issues straightened out.
Mm-hmm. Yeah, this should not be the patient's responsibility. We are aware that we can definitely improve the communication with the VA and the vendors, as well as our veteran patients, in terms of what to do in terms of troubleshooting, who to contact, and also what information is necessary. It's an important enough issue that we're actually hiring liaisons with our community partners so that we can actually educate them, provide them the resource materials to understand and work with the new system. It has been challenging. I do understand that the communication has been less than optimal, and we're working to improve the communication both from the VA and from TriWest to the vendors.
Thank you for that. And is the caregiver program just for veterans, or does it include spouses?
Lindsay? You're muted.
Oh, let me.
Oh, she can't get unmuted.
Yeah, we get a couple trolls, so we had to put in our super security on them.
It's okay. So the caregiver program is to support caregivers of veterans. So I think the question is, if you as a veteran are a caregiver, is that what I'm being asked? Are we able to support veterans who are caregivers?
Looks like that question is coming from Sin.
And unfortunately, our program is not currently developed to support veterans who are caregivers. We are a program who supports caregivers of veterans. And now working with a primary care social worker, they would be able to provide you with information. There's also a caregiver support program that the state provides for each county that would be able to provide support to you as well.
All right, looks like, what is the plan for helping the Skagit CBOC that is overwhelmed with veterans from Whatcom and Snohomish counties, as well as Skagit County veterans?
Okay, so the Skagit CBOC, that would be our Mount Vernon CBOC. So yes, so actually one of the impetus for us building our new clinic in Snohomish, which is based in Everett, was because of the fact that there wasn't a clinic in the Snohomish County. And so the veterans had two choices. They go up to Mount Vernon or they go down the I-5 corridor to Seattle. So you can imagine what the number one choice was. We're going to go north to Mount Vernon. So Mount Vernon became overwhelmed. With the opening of the Everett Clinic, that will significantly offload the Mount Vernon CBOC. We're also looking at options for when we renew the contract for the Mount Vernon CBOC to also open up smaller satellite sites to support veterans in the Bellingham area and also on more towards the island area as well. So in the coming 5 years or so, we will probably have more than just a Mount Vernon clinic. We'll also have satellite clinics to support Whatcom and Snohomish and Skagit County.
Thank you. Looks like we've got another question from Bob, and Lisa, feel free to let me know how we are on time. Bob's question is the messaging function of My Health eVet still working, specifically in the Spokane VA?
So the messaging is working in the Puget Sound VA, but specifically for Spokane, I know with the conversion to Cerner, they were having issues with that. So we will have to get our Spokane counterparts to respond to the person who requested that question.
Awesome, thank you. Looks like, I think we might have a comment from Lisa. Would be interesting to know how the process is done when your PCM from the VA refers you for community care. Who does this referral go to? Does it go directly to TriWest or to someone else? It'd be very helpful if a veteran could get a courtesy call indicating their PCM has a consult in and that a veteran should hear from a TriWest in 90 days. That way a veteran knows that the consult is in.
So yes, I would agree. That is the ideal model. So in terms of when your PCP puts in a referral for a specialty care, the specialty care referral is first touched by our specialist to see if that care can be provided within the VA. If it's appropriate for the care to go out into the community, whether it's because of wait times or because of where the veteran lives, then that consult is forwarded to community care. The community care scheduling is done predominantly by VA schedulers with a small proportion of it going directly to TriWest, which is what I was referring to before. So the basic care, the non-complex care is scheduled by TriWest. The more complex care we keep in-house because it requires a fair amount of coordination for, let's say, someone who needs orthopedic surgery, spine surgery, and the most complex, of course, is dialysis and the oncology. So I actually think that's a great idea for us to be able to reach out to the veteran and let them know that we received a referral from your provider and letting them know that either the VA or TriWest will be reaching out to them to schedule. Our plan, I heard the 90 days there. That's probably what it is currently. Our hope and our target is to get that down under 30 days.
Dr. Morantes, I was the one who typed that question in. So during the pandemic, I switched my care to the VA. I go to American Lake. And last year, the orthopedic doctor that they assigned me ordered an MRI and X-ray on my knee. And when the result came in, I really appreciated it. She called me and told me that there's nothing they can do. She asked if I want to do the RFA, and I told her I already did that. And she told me, well, your last recourse is to have a complete knee replacement. Did you want to do that? And I said, yes. So this was way back in February. So I've been really waiting patiently. And she told me, I put in 3 consults for you. And I don't know where the hiccup is. it's just like very frustrating not to know where you are at. And I participated in the town hall that Dr. Boyd had done, I think in March or April. And she told me, said, "Oh, did you call your patient advocate?" And I said, "Yes, I did." And I left numerous messages and never get a reply back. And yes, I mean, this week alone, I gotten calls from veterans thinking we are the federal VA, asking me, "Hey, what happened to my consult?" And I told the veteran, I said, "No, we are not the Fed VA. You have to call your, uh, provider. You can do it via the Healthy Vet, all those kind of stuff." And, like a person can only be patient to an extent. You know what I mean? Like, I'm very fortunate that I have TRICARE as well, that I go to Madigan as an alternative, but I wanted to experience how it is going through the VA, because I mean, like, for many years, I had told Congressman Takano that, I'm eligible for VA, but I had mentioned this to Tammy too, because of the bad experience veterans have. I was kind of hesitant. And then uh, the one that really persuaded me to go, my sister is one of the primary care at American Lake. And then she said, you need to give them a chance. I mean, they're very compassionate and stuff. And I did. And yes, they're very compassionate. And I think the hiccup is I can also understand about the lack of medical providers in the country, and that's an issue. And like, veteran is understanding if you only give them, like, hey, yes, your provider put in a community care for you, a referral, but please be patient while we're working on the hiccup. And sorry, uh,
Yeah, so
All right.
Ms. Narciso, I greatly apologize for the delay that you've had. And unfortunately, I hear this story enough that I know that we have a significant problem. And that's actually why I am putting 100% of my efforts to fixing this problem for you. I have your name. I will look at it into this situation personally, and I can guarantee you that someone will be reaching out to speak with you. But it's not, we don't want to just solve it for one veteran. We want to solve it for all of our veterans. So we're working on a process to fix this once and for all.
Thank you. Our next question comes from Art. Can a family member be an authorized caregiver for their father who's 100% disabled Purple Heart veteran? Can they be paid for the caregiving?
Family member, veteran is 100% service connected. So it absolutely depends on if the veteran meets the eligibility criteria, but that's the first couple of the 7 eligibility criteria. Veteran over 70% service connected. I don't know that the era served, so I would encourage them to apply. Absolutely.
Awesome. A veteran friend from the Puyallup area needs replacement glasses. Where can he go?
Okay, so when was his last, the contact the VAI clinic at American Lake, and they will be able to set him up an appointment to get his vision checked and give him new glasses. Now, if it's just replacement glasses, they can authorize for those glasses to be filled through the optical clinic at American Lake. Hopefully that's helpful.
Awesome. Looks like if it's possible to provide contact information for both programs in Clark County, Washington, that was requested. Is there not aid and attendee available for surviving spouses?
I'm going to defer to Lindsay on that, and
Yeah.
Lindsay might defer to someone else.
Well, so Aid in Attendance is the Veterans Benefits Administration program. And so I am not familiar with the ins and outs of that program and would encourage you to talk with the VSO regarding aid and attendance.
Awesome. All right, looks like from next question comes from Alita. Is there any mechanism for the VA to be utilized as a secondary or tertiary financial, sorry if I didn't say that right, that word correctly, financial coverage for a veteran who can't wait to be seen by the VA and will instead use another insurance coverage to get help?
Lindsay, did you?
I
so
started to
I think,
answer that. So the VA is a single source payer. We pay ourselves, and we, from my understanding, we are not the type of insurance that's portable, unless I have that incorrect. Unless we authorize it, like our community care authorizes it.
All right, appreciate
Is that correct, Dr. Morantis?
correct.
And then can you please give a clear definition of eligible veteran? She said 70%. What does this mean?
So I would encourage you to, I did drop in the comments the website address to the caregiver website, where we have an eligibility fact sheet, and it goes into depth around the eligibility. So 70% is either 70% with single or 70% combined, but eligible for the program is much more in depth for what it means to be in need of personal care services. So I would encourage you to look at the fact sheet for eligibility criteria for the program specifically.
And we reposted that website and phone number there on the bottom of the chat, so you don't have to scroll back up everyone to get that information. And it's like, I think might be our last question here in the chat. Is it better to go to the major hospital for replacement glasses or hearing aids so you don't have to wait a year?
So in regards to both optometry and audiology, these are both what we refer to as direct scheduling, in terms of in that you do not need a referral to reach out to these departments. So what I would suggest that you do is to reach out to the department at whichever of the two major facilities is closest to you. So either Seattle or American Lake, contact their eye clinic or contact their audiology department in terms of what is the best option for you. Now that we are fully opened up and our clinics are expanding their appointments, you may actually be able to be seen much more timely within the VA. Otherwise, if not, then you can opt to go out into the community. Again, I know that there's been long wait times to get your care in the community. A lot of this has been out of our control, but it's not out of our responsibility. It's our responsibility to fix this, and we are putting everything that we can into it. And I can assure you that this is definitely going to get better. And we want to be able to have a system in place where when you put in a consult, it gets reviewed within 48 hours. A decision is made as whether it's going to be seen in-house or out in the community within a week. The referral gets sent to the appropriate place, and the scheduling process occurs within 2 weeks.
Awesome. And I think we were able to actually respond to every single question in the chat. So I want to thank everyone's patience for allowing the presentations and for sharing those questions. I'll kind of give one last kind of effort here. I think we have a few minutes. If anyone has any last question and wants to send that in now, otherwise sounds like I'll turn that back over to Lisa and Chuck. And I definitely want to thank very, very deeply and kindly both Connie Morantes and Lindsay Pineda for just answering all these questions, providing updates, being available to just be present, be here kind of in a live setting to answer some of these questions that are going on. We have recorded the session too, so we'll make sure we make this available and posting this online. So anyone that wasn't able to attend today's meeting will be able to kind of hear some of those answers and hear some of those questions. And so we definitely want to thank you again for being available, for presenting, and for just answering so many and literally all of the questions that we've had in the chat box. So we thank you for that. And I will turn that back over unless anyone else has any other question. Looks like they provided both the email, their personal email there as well. I mean, their work email there. So if you have any questions and want to ask any follow-up or miss something, or maybe just something personal you didn't want to share in a public setting here, please grab that email there. It's in the chat box. Feel free to email either myself or from, looks like Connie, you put yours. I'm going to share yours, Connie, publicly, if that's okay. I think you might have sent that one just to me since I sent you a message before. So we'll share your email with the world there. And so it looks like we've got one last question here, Jose, and then we'll turn it back over to Chuck. If we can get this, will the VA long-term care services qualify veterans for an exemption from the upcoming VAAC long-term care insurance tax program?
I'm not familiar, so I'm not able to answer that question. I apologize. I have a question back to Jose, if I may ask. Jose, what is your understanding of the VA's long-term care services? I was hoping to understand what you are defining them as.
And Jose, you're also able to unmute
if I could
yourself.
ask that back.
You're able to unmute yourself, Jose, if you'd like to ask. Yes, sir.
Yes, I appreciate it. So this is a sort of a odd question, and I'm just being proactive about it because I know that we're going to be hearing about this question very soon from a lot of veterans. But in the VA website, it states that all enrolled veterans are eligible for these services, which means the VA long-term care services. There are some requirements under that, but the question is not whether all veterans are eligible for the long-term care service, but if this blanket statement is acceptable to send into this tax that is coming as a replacement.
So I could definitely look into this, Jose, if you let me know how to get back to you. I would like to look more into what they are defining as our long-term care services, if they're, it's just because it's a really big umbrella term. And then that might help me be able to answer it better. Because I mean, long-term care services can be very small, like helping with advanced directives, or very big, like skilled nursing facilities and things like that. Right. So I'd really like to look into what that definition is and then get back with you.
Yeah, thank you. I know it's a very unrelated question to ask, but I figured out.
Okay, I know where I can go with it.
Thank you.
Yeah.
All right. Well, I want to thank you one last time. I think I will turn it back over to either Chuck, our VAAC commander, or Lisa, and give one last thank you again to both Connie and Lindsay there, and Tammy as well too. And I will make sure I send you a copy of all the questions that were asked, as well as a link for today's presentation to you as well. So we thank you for your time and for answering so many questions.
Thank you for having us.
Thank you so much, Dr. Morantes and Ms. Pineda. That was really very enlightening. Now I know what to tell the veterans that calls me. And my other one is like for providers. So who do they connect to at the VA? Because I have a couple of providers left phone message on my phone yesterday asking me what is the process for them to be part of your network. Mm-hmm. So I should be able to tell them where do they have to go.
So if these are community providers who want to enroll in the network, okay,
yes, ma'am.
Then let me send you the name. Let me make sure I want to send it to everyone as opposed to just Gary. So Renita Walker, Renita is our Chief of Community Care. She handles the administrative side. And so she would be the one that would be helping providers enroll in the system.
Okay, I know her. Thank you so much, Dr. Morantes. I truly and greatly appreciate it. And Tammy, I would be remiss if I don't say thank you to you. It's always so great and awesome to work with you guys to get answers to the question and all those kind of good stuff. So last call for participants. If you have any question, Dr. Morantes and Miss Pineda are still here, so it's your chance.
All right, Lisa.
Yes, sir.
Okay. I'd like to also make sure we point out that on behalf of the Governor's Veterans Affairs Advisory Committee, we would like to thank both Dr. Morales and Ms. Pineda for all their time. And I would also like you to put your email address in the chat box so that people who need something specific can send you an email, and you can forward it to one of the VAC members who has little expertise in that area, so we can assist any veteran in the state with getting the care locally as best they can. That is part of our job, to communicate all that stuff. So both my gratitude on behalf of the VAC to all the VA personnel, all of the WDVA personnel. We sincerely appreciate your cooperation in helping us help the veterans of Washington State.
I feel like I'm getting coined virtually.
I'm trying.
I know. Like I should get my coin now.
We all know. We all know from both the patient side of the table, the provider side of the table, and the administrator side of the table, how difficult and how complicated many of these subjects are. The processes that are put in place are sometimes more complex than the average person knows about, and that creates a lot of frustration. We all have the same goal here, and we really appreciate you being part of the team.
An honor to serve those who have served.
Yeah, I owe Miss Pineda and Dr. Morantes our agency coin as well. And I believe Tammy already have one.
We'll go rub Tammy's coin.
Yeah.
All
Thank
right,
you again.
Yeah,
for
Gary,
having
do you have any more messages? Any more questions? I didn't see any.
What was that again, Chuck? I'm sorry.
I didn't see any more questions in the queue.
No, I think we got all the questions that were there.
Okay. I'd like to ask if both Dr. Morantes and Lindsay Pineda would send Lisa an email. I know we've already got your email addresses
Okay.
and phone numbers on the chat, but a lot of the people who aren't using a full screen, maybe they're on a cell phone, it's extremely difficult to get that stuff down. Sometimes people are not adept enough at doing screenshots. So
I already did that, Chuck. I have their email address.
Okay, so
Yes.
for anyone who's on right now, and my screen says we have 41 participants still online. If you need these email addresses or these phone numbers for VA personnel or WDVA personnel, send an email to lisan@dva.wa.gov. That's that smiling face Lisa Narciso you see right in front of you right now. And she will make sure that she gets you in touch, or she'll help one of us help you get in touch with the personnel you need for the information you require.
We also remind you, if you visit our website, dva.wa.gov, or dva.wa.com, I'm sorry, I'm thinking of her email. You can click on resources, and we have a drop down with every county in Washington State. And we have a lot of different, whether it's VSOs, educational resources, clinics, urgent cares, all within those counties with the information there. So we always invite you to visit our website, click on resources, and drop down on whatever counties and or whatever resource you're looking for.
Yeah, and I also want to plug in that the biggest overnight parade in our state is a go this year. So our agency and your governor's Veterans Advisory Committee is also soliciting nomination from the community for an outstanding individual who goes above and beyond, what is, I know there's a lot of unsung heroes out there, so this is your chance to submit nomination. It's in our website as well that Gary had mentioned. Chuck, any last words?
Well, my screen says we still got 41 people online. I would suggest to Mr. Lott that we leave the screen active on the chat side so that all of those people who are still on have the opportunity to write down those email addresses and phone numbers that were placed in the chat.
Absolutely. I'll gladly leave the meeting open for a few moments after, a few minutes at least after, so you can capture all those great emails.
Yeah, I know we have a lot of people who are on the phone looking at the chats, the participant list. So it's difficult to participate from that level sometimes.
And I'm going to,
I've done it.
I'm going to go out on a limb here, and I'm going to allow participants to unmute themselves. So hopefully we won't have any more trolls on the screen, but in case we had anyone who wasn't able to actually chat or type in anything that had a question, you're able to unmute it now if you want to kind of say anything or ask any last questions.
This is veteran Jeff Getty, disabled vet. There was a question on glasses. I had the prosthetics department send me over from Seattle over to Kitsap Optical to get my glasses. I would think there'd be a closer place than having to go across that far to get glasses. It's over 100-mile round trip. Perhaps you could enlighten veterans where a closer place would be.
Yeah, it's unclear to me why they would send you 100 miles away. I know that we have vendors much closer to you all. So if you could send us your information, we can look into that. But no, you shouldn't be going 100 miles away to get your glasses. Our goal is to be able to get you within 30 miles at the most.
Appreciate that. I don't understand why either.
And not sure, are you able to access the chat box, sir, to put in an email, or is your contact information, the cell phone number, the best way to touch back in?
I can't do it. I can't do it, but I'll have somebody help me.
Okay, maybe Dr. Morantes, you can write down the phone number. It's 206-399-0093. And what was your name again, sir?
Jeffrey Getty, G-U-I-T-E.
All right, we have your phone number, sir, and we'll have someone reach out. That way you don't have to get someone else just to help you with the email, sir.
Thank you, sir.
Looks like Robert, you might have a question. Go ahead, Robert.
Yes. Could you repeat the contact email or website for all of the contacts for clinics and all that? Or put it in the chat?
Yes, ma'am. We have it in the chat. It's also Lisa, L-I-S-A-N as in Nancy, at DVA, that's David Victor Alpha, .wa .gov as in Victor. Lisa N at dva.wa.gov. And if you send it, yeah, absolutely. And we'll be able to get you any kind of resources or in contact with any of the presenters there by contacting there.
Thank you.
And Tammy kind of commented back, that's interesting about glasses. I live in Winlock and have been getting sent to American Lake for vision and glasses for the last few years. That's 50 plus miles one way. And
I
we're
have
still,
a question.
yes,
Sorry.
TJ, please.
Yeah, my name is TJ Mullendijk and I live here in Seattle-Woolley, Washington. And I was the one with the questions about Skagit Valley. Because Skagit Valley, it just seems that it gets lost in everything. And so we have the CBOC here in Mount Vernon, and the office for the optometry and audiology, it's always a problem. It seems that they can't have anybody that is employed. And so what are we going to do to fix that?
So the last part of your statement that they couldn't have anyone that was employed, does it mean that they don't have the staffing?
They don't have the staffing or they don't have somebody at the front desk. It's like you've got one person that does optometry when you could probably have two people that can do optometry, and there's no, it's not there. Audiology, that's a problem too. So when you want to call in to make an appointment, you have to call in to make sure somebody's in the office. And if nobody's in the office, how do we get to appointments because of this?
Okay, so Mr. Mollendick, I will actually follow up with that. I do know that during the pandemic, of course, they were backing off on routine care. They should be fully open now. I'm not aware of any staffing issues at those sites, but we do need to optimally staff them so that you can utilize the site, which is what it was intended for. So I will reach out to both audiology and optometry, and someone will call you back, Mr. Mollendick.
Well, I have something else to say about that. The whole thing with Tri-West and having to wait for them 6 months to a year for glasses, or even when you get hearing aids every 5 years, and you have to wait a year or so. That's unacceptable. And I feel Tri-West is well, Tri-West is taking your money and stealing from veterans. I'm sorry to say that, but Tri-West, it sucks. And I'm just saying that.
Thank you for the
I
feedback.
agree.
And I agree. It's unacceptable to have to wait that long. And I am doing everything that I possibly can to improve the process. I strongly believe that we can do better scheduling within the VA. I just need to get the MSAs on board to do that scheduling. And the VISN is helping me out with that. So if you know of anyone who wants to be an MSA in the VA, send them to us.
Dr. Morales, Chuck Wharton here. My screen's name says District 6 Commander. As a 45 plus year outpatient of American Lake, I've probably been in 20 different VA hospitals west of the Mississippi in the last 45 years. One of the problems I encounter frequently at the provider end of community care is that either the instructions for how to do billing aren't perfectly clear enough for the level of technician that works for the individual provider, or perhaps larger print and rewording or more specific instructions on where to send the bill and how to coordinate the care for the veteran, i.e. forwarding of records. I have two separate community care providers in the Tacoma area, and both of them uh, I've had them actually hand me the letter, the authorization letter that they receive, and then ask me, where do I send a request for an extension? And I have to circle it on the form. Now, I'm not claiming that the provider technician at the window is inept, but the wording and the verbiage might be perhaps written in a little bit less complicated a fashion. If you could have someone look at that, maybe we could improve that a little and avoid some of this confusion.
Mhm. And that's where our the community care liaison that we're hiring is going to be working on that to work on both the letters that can be sent out to the veterans to make sure that they're clear, and also the instructions for the community care providers on how to navigate the new system.
Thank you.
Thank you, Chuck.
I have a question.
Mr. Black?
I'd like
Thank
to
you.
actually give give it to Tammy next. Had her hand up, and then we'll move to you next. Go ahead, Tammy.
Hello. So yeah, you've seen my comments about community care. It's been an ongoing issue. I get a lot of care at Olympia Orthopedic, and there's consistent issues that they have communicating with the VA, and whether it's TriWest or the VA itself, they actually prefer talking to TriWest because getting through to the VA, even for them, takes hours on hold, which seems even more ridiculous. But trying to formulate my thought, sorry. It says every single referral I get has been a battle. I'm an old Army medic. I actually used to work with Lindsay Pineda when I was active duty. And so I'm able to navigate the system better than most veterans are. And I still have issues, you know, calling this, calling that, people pointing fingers saying it's not our fault. I actually had a VA rep yell at me the other day. So, because I asked her to contact the PCM at the VA at the Red Clinic and ask them to get in touch with each other to figure out the problem. And it was a missing ICD-10 code. That's it. This is really not acceptable. And the other issue is billing, like Commander Wharton mentioned. I get bills to my home address all the time because they get sent to the wrong spot because it's not clear where they go. And so I have to call the various vendors and say, you need to bill TriWest, here's the authorization number, here's how to do it, here's where to put it on the form. And I'm spelling this information out to them, and I've been doing this for a few years. It's just, it's really quite ridiculous. And yeah, and going back to the whole community care thing, I had an authorization approved in February. I was never notified about through CCN until a few days ago. And I have yet to get any letters from VA saying, hey, by the way, these are approved. And then, yeah, just being on hold for hours is insane. So I shouldn't have to call them, to be honest.
So Tammy, let me reach out
Yes.
to you, and I'd like to discuss more specifically with you and get your feedback.
Thank you.
Can I throw my 2 cents in here in reference to Tammy's comments?
Please do. And then it looked like Ron had his hand up, I believe.
Oh.
Yes, please go ahead.
Well, you know, Tammy made a clear point. You know, I'm going from my own personal experience. Before the community care changed over, things went really smooth. Now with this change, it's a real big fiasco. First and foremost, I personally have been sent to collections 3 times, and I think I finally got it all resolved. But yet I went to collections. I want to go back to a most recent experience. Last December, I had a catheter ablation, and post-catheter ablation procedure, the University of Washington doctor, you know, took a peekaboo look, and he said, "Oh, we have another issue here." Well, that was last December. That was brought up, and as we sit here today, there has not been a follow-up. Community Cares reached back out to the University of Washington, but nobody's gotten back to me. Now, originally, when this occurred back in December, as protocol with the VA, if another facility does an unauthorized medical procedure, then that's left to the veterans issue. So everything has to be, you know, blessed by the VA. So that's why everything stopped last December. But still, as we speak today, the post GI thing hasn't been done. So That's the biggest problem. It takes too long to get any procedures. In fact, I haven't even seen any authorizations from community care. And that's the biggest thing. You know, the government, you have to have the documents in tow. If you don't, they're going to deny it. And without those documents, you're left holding the bag. And the veteran shouldn't be left holding the bag on any of these bills. That's it.
And so I keep on seeing something flipping back and forth. So was this Henry or was this someone that
No,
signed on with
I'm
the?
Henry. Yes, I'm
Okay.
Henry Gossage. I'm out of the DAV 41. Ryan Neighbors is in 41. So yes,
Okay,
I've been
so-
a chapter service officer for 20 years.
Okay, so Henry, could you spell your last name?
Gossage. Now, while you're taking your notes, I want the community care young lady was very good. She got back to me, and she's been following me like fly on shit, really. But she's been on top of this. But we're finally, I don't know where we're at, but she's still working on it. She hasn't given up. So give her credit. You know, but before that, honest to God, before that, it took forever to get anything. It was like pulling teeth.
Okay, Henry, let me look into this and then I will also touch base with you just to make sure that I have all the specifics.
Sounds good. Thanks.
Thank you for sharing that, Henry, and thank you for sharing those good comments as well too. And I think we've got about 7 minutes until our meeting is over. So I'm gonna as many questions. If someone's still got, it looks like Chuck. You have something, Chuck?
Yeah, Gary, I like to give Chaplain Black time to get his question in, and then I wanted to go to Jose Vargas.
Awesome.
I have a question if I could get, this is disabled vet Jeff Getty. If somebody could help me with it, I'll keep it brief.
Yeah,
right.
I want to make sure we get Ron a chance. Then if we can get you to write in the comments, or we'll get to you after that order. I know Ron's been kind of waving his hand for quite some time, so I want to get to him next in all fairness. But absolutely, please share that question in the comments, and if we have enough time, we'll get to you right after. Please go ahead, Mr. Black.
Thank you very much. I don't know if she can see me or not, but and I don't know how to do that. But Doctor, thank you so much for being here today. I do need to represent my area, I guess, with a question. Pacific County has an extremely high number of elderly veterans. And my concern with Lewis County, even though you're saying it's not been decided on yet, that facility is really the only access they've got to any kind of VA healthcare. And for most of them, that's a 50-mile drive. To pull that facility is going to leave Pacific County with almost no VA healthcare access at all, unless they're willing to drive long distances. And we have almost no contracted providers in Pacific County. They gave up and went away long ago. The mobile unit is what we often get stuck with down here, and it is very inconsistent, always has been for years. Sometimes it's there, sometimes it's not. The bottom line is if there's nothing there, then those veterans have no access at all. So I'm real concerned about any talk about closing the Lewis County facility when it isn't really, in my opinion, looking at all of those veterans, hundreds of them who rely on that facility for their health care from Pacific County. Thank you so much.
Okay, Mr. Black, I will make sure and relay your concerns to the committee that's looking at that.
Thank you.
Next up was Jose Vargas. Go ahead, and then we'll jump up lastly to you.
Okay, good afternoon. And this actually doesn't have anything to do with VA. It's just a real quick kind of comment regarding the traditional Veterans Day and Memorial Day ceremonies that are been happening for years at the Capitol Rotunda. And I just wanted to let everybody know the group that has been organizing these ceremonies for many, many years. I don't remember, it's more than 10, is the Thurston County Veterans Council. Right now, the council, because of retirements and members getting up in age, is down to 2 people. Myself, I'm the outgoing co-chair, and Ms. Christine Dominguez, who I understand now works for the DBA. My wife and I are going to move in out of state next month to the beautiful state of Florida. And that means that the group is down to 1 person. And I'm concerned that now that we're hopefully going back to the new normal in the state of Washington, there's not going to be anybody organizing this ceremony. So I just wanted to put that in the table for the committee. Hopefully, maybe somebody can do something or can help organize these ceremonies, because I hate to see them go away just because there's nobody to organize them. And that's it. Thank you very much for the opportunity.
Thank you for sharing that, Jose. And yeah, I'll kind of add on top of that, an amazing event. And we want to make sure that we kind of still keep that committee behind that and helping and assist with that. So if anyone's interested in finding out a little bit more information or maybe joining the committee to help with those events, please email that Lisa's email. We'll get you squared away with the correct contacts there. I believe the next question was, I think it was Mr. Bugetta. If I'm saying that correctly, I apologize. Go ahead, please, sir.
Jeff Getty. Are you talking to me, Jeff Getty?
Yes, sir. Sorry about that. Did you have a question?
That's quite right. Yeah. Disabled vet, sir, 65 to 69. 12 years ago, when I was 63, I was diagnosed with severe knee related injuries from the military that required a knee replacement. I've been working 12 years to get the knee replacement. Because I didn't get the knee replacements, I had 4 trips to the emergency room with many different injuries, broken ribs, arms, and whatever, and concussions. And now, after 2018, I was scheduled to go into Valley Medical and get the knee replaced, but I had 2 heart attacks since then. And so now I'm in a position where, after 7 months of cardiac therapy at Valley Medical, I was hoping to just reestablish through TRICARE and get the knee replaced, because it was already approved once. But now the VA is throwing me back into the pool of wearing heavy metal braces on my legs, which you cannot walk with. I'm required to walk 45 minutes a day, a brisk walk for my cardiac therapy. I can hardly move, and metal braces do not make it easy to walk 45 minutes. I have no doctor now. My primary care doctor resigned, and now they want me to go back wearing metal braces. How does one get back to where you've been approved for the knee replacement, so I can get this knee replacement? Because this is life-saving. I have to walk 45 minutes a day to keep my heart functioning, and I can't do that. And I've already had 2 heart attacks, none of which any of this needed to happen, but because I didn't get prompt knee replacements, I couldn't exercise, couldn't walk. And so now I'm fighting for my life. And I thank Ryan Neighbors for all of his help. He's been a godsend to help me get to where I'm at. But I have no doctor now. My doctor left or whatever. I guess maybe I complain too much. But how do I get back to the 2018 knee replacement approved? TRICARE had it all arranged at Valley Medical, and they won't even talk to me about that now. And I don't know what direction to go into. That's why I'm bringing this up to you. I have no primary care provider at the VA. I don't know what my next step could be. And if I sound frustrated, I apologize.
Mr. Guietta, is that how you pronounce your last name?
It's just like J. Paul Getty.
Oh, Getty. Okay, Mr. Getty. So yes.
G-E-T-T-Y.
G-E-T.
It's spelled G. It's spelled G-U-I-T-E, but it's pronounced G-E-T-T-Y, like Gettysburg.
Yes, because I recall. So we heard your comments about the eyeglasses and now the knee replacement. So I will make sure that we get you assigned a primary care provider so that we can get this going again.
Thank you so much.
You're welcome.
Thank you, Dr. Morantes. And we have reached our 1 p.m. Closing time here. So in promising to make sure I can leave the chat open for a few more minutes and making sure I'm not missing our next meetings that's going on and respecting everyone's time. I want to once again thank everyone for joining us. I want to thank our hosts as well for answering so many amazing questions and for all those follow-up questions and contacts that'll undoubtedly take place. I think everyone has Lisa's email, so we'll make sure you can send that for if you didn't receive the emails, if you need a little bit more follow-up information, if you wanted direct link to the resources list on that website, or if you're interested in connecting and assisting with the Veterans Day and Memorial Day events that take place in the Capitol Rotunda, please use that Lisa email. So I once again will thank, and then I will hand it right over to our VAAC commander, Chuck, for our final words. Go ahead, Chuck.
Yeah. Since we have reached our timeline, I thank you, Gary, for leaving the chat open as long as you can so that people can get the email and phone numbers out of it. And Mr. Chairman Wallace,
Yes, sir.
barring any objections, sir, we want to close today's meeting by thanking everyone for coming on and reminding everyone to send those emails, and we'll try and direct you to the proper place to get the care you need. Anything from you, Mr. Chairman?
It's been a very interesting meeting, and I really enjoyed the two young ladies from the VA hospital. I think we learned a lot today, and I think they learned a lot also. Again, thanks everyone for coming in. Let's go ahead and adjourn the meeting.
Well, Mr. Wallace, you made my day by calling me a young lady. Thank you.
Yes, sir.
Anyway, thanks, guys.
Thanks.
Really appreciate it.
Thank
what you've done.
you.
Thank you very much.
Thank you. Have a wonderful afternoon.
Thank you all.
All right.
Good night.
Gary?